This has been Elizabeth Wangeshi and her 3-year-old son John's daily routine for the last 10 months. They have been confined here at this MSF clinic on the outskirts of Nairobi's central business district.
I take those 13 tablets. I go for injection. That is a routine every day, and you have to do it. If you vomit it out, you have to swallow another one. Then it is come my child. I have to make sure he has swallowed the medicine, which is anasema me, I don't want this, mom. And you have to force him, or you have to know which way, the best way you will do for him to swallow.
2 years ago, Elizabeth dutifully breastfed her son John. Little did she know that she was passing on a deadly infection, an infection she didn't even know she had.
I started by fever, coughing, which I went to just a nearby chemist and bought some tablets. But I came to realize that after finishing those tablets, now the fever and the coughing was worsening.
Elizabeth was then diagnosed with extensively drug-resistant TB or XDR TB. It's a rare and severe form of the bacterial infection that is resistant to the most effective first-line and second-line TB drugs. Many countries lack the tools to properly diagnose the disease.
It was very difficult for everyone because we didn't have these drugs in place, and we have to make heads spin around, try to, through the Ministry of Health, to be able to get these drugs as soon as possible.
For now, I'm relaxed. I can say it is like normal life. I'm used. But the time I was starting, even just to swallow one tablet, it was difficult.
Elizabeth, an elementary school teacher, has had to give up her job. The good news, though, her husband and daughter have managed to stay free. Well, although medics say Elizabeth currently does not pose the risk of transmitting the highly resistant strain of TB, she's barely through her treatment, which will take at least 24 months. It is a predicament she shares with many others at the clinic who are suffering from multi-drug resistant TB. Currently, 48 other patients at the clinic are being treated for multi-drug resistant TB. Doctors say administration of improper treatment regimens and adherence or failure to ensure that patients complete the whole course of treatment has seen the rise in numbers.
Just think of this, if someone you have been told to be taking these drugs for the rest of 24 months, every day you come here, you have other things to do and you have to report here.
At the MSF Center, treatment is free, taking a huge burden off Elizabeth and the other patients, as it cost upwards of $4,000. And with daily improvement, Elizabeth is hopeful about the future.
I wish one day I will just come out of that door and will never come here back again. I go back to teaching.
Kiyo, CCTV.